Let's bring in President Biden's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for coming back on This Week this morning. You just heard Nate's perspective right there, fairly balanced. What's your take on this BA2 variant?
Well, as was said, it has a degree of transmission advantage over the original Omicron, but not multifold advantage. So it's about 50 to 60% or so more transmissible, which means ultimately over time, it might take over as the dominant variant. Clearly, throughout the world, it's about 80+%, 85% of the isolate. In the United States, it's still somewhere around 30%. So it does have an increased transmission capability. However, when you look at the cases, they do not appear to be any more severe, and they do not appear to evade immune responses, either from vaccines or prior infection. So the bottom line is we likely will see an uptick in cases as we've seen in the European countries, particularly the UK, where they've had the same situation as we've had now. They have a BA2, they have a relaxation of some of the restrictions, such as indoor masking, and there's a waning of immunity. Hopefully we won't see a surge. I don't think we will. The easiest way to prevent that is to continue to get people vaccinated, and for those who have been vaccinated, to continue to get them boosted. So that's really where we stand right now. We can expect to see an increase, yes.
We've seen this relaxation of restrictions all across the country right now. Any reason to reverse that?
I don't think so, George, not right now. I don't see us going back into any more really very strict kinds of restrictions, but you always have to have the flexibility. Remember, when the CDC came out with the modification of their metrics, which would lead to the guidelines of what regions or counties in the country should have a masking indoor, they made it very clear that as you pull back on restrictions, if we do see a significant surge, particularly one that might result in increased hospitalizations, we have to be prepared to pivot and perhaps reinstitute some of those restrictions. But right now, at this point, George, I don't see that.
How should we be taking advantage of this moment right now? I was struck by something Anne Ramoyne, a UCLA epidemiologist, told the New York Times this morning, who said we've been wearing rose-colored glasses instead of correcting our vision. Her point is that we should be much more proactive. Does she have a point? What more can we be doing to protect against another surge?
Well, I think she makes a very, very good point. I mean, we only still have about 65% of our population has been vaccinated, and of the total population. And of those who are eligible for a booster, only about 50% of them have been boosted. There are a lot of things that we can do from a public health standpoint. The other thing we can do, and I hope that we get the funding from the Congress to do this, is to continue to build up our supply of antivirals, of tests, and of the ability to give boosts. I mean, we have a number of clinical trials going that are trying to determine what the best combination of boosting is to get both effectiveness and durability. So we just can't stand still, particularly as we appear to be in somewhat of a lull in the cases, where cases continue to come down, deaths continue to come down, and hospitalizations. That's no time at all to declare victory, because this virus has fooled us before, and we really must be prepared for the possibility that we might get another variant, and we don't want to be caught flat-footed on that.
Dr. Ashish Jha is going to be the president's new COVID coordinator, replacing Jeffrey Zients. He's never worked in government before, as you've pointed out. What advice do you have for him, and what's the most important thing he needs to do?
Well, first of all, he's a very competent person. I mean, he's been involved in this, not in the government, but from the outside. He's an experienced public health person. I think just to get to know the ropes in the government and coming from outside the government into the government. But he's going to have a lot of help, a lot of encouragement, a lot of collegiality from people like myself, from Dr. Walensky, from Dr. Murthy and others. So I think he's going to be just fine.
You know, you've said you're going to stay in this job until we get out of the pandemic phase. Of course, you've been serving your country now for decades. Are we approaching the point where we are past the pandemic phase and you'll go get some rest?
I'm not so sure, George. I want to make sure we're really out of this before I really seriously consider doing anything different. We're still in this. We have a way to go. I think we're clearly going in the right direction. I hope we stay that way.
Dr. Fauci, thanks as always for your time and your information.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.